Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in the Conversation with Cancer Experts series, I have a leading expert on myelofibrosis with us, Dr. Abdulraheem Yacoub, who's professor in the Hematological Malignancy and Cellular Therapeutics division at the Kansas University Medical Center. And he's going to tell us about how he treats myelofibrosis. We love to hear it from the expert. So welcome, Abdulraheem.
Thank you very much, Ravi, for the opportunity.
So, can you tell our audience about myelofibrosis, how common it is, and what are the outlook for this disease? It's becoming a disease that more and more people are hearing about as more and more drugs are coming out.
Yes, thank you, Ravi. So yeah, myelofibrosis is an uncommon malignancy. One would say it's a rare malignancy, actually. The incidence is roughly under 3 per 100,000 person years, which runs around to be close to around 7,000 cases, new cases every year in the US, around 100 to 150,000 cases in the worldwide every year. With cancer being so uncommon, it is likely that most physicians encounter, unless you work in a high volume center, it is likely that you'll be encountering less than a handful of cases a year. So it is not a disease of high prevalence, but because of recent advances, as you mentioned, it has become very visible disease, and we're looking for those patients to try to help them given the advancement of the tools we have right now. The prognosis has changed a lot over the years. So 10 years ago, the median survival was under 5 years for all comers. Right now, the median survival is in the range of close to 5 to 10 years now for all comers. So really, there has been a significant advancement in patient outcomes over the last decade.
So, let's hear about how this has happened. So, what are your goals of treatment when you do see a myelofibrosis patient?
Yeah, so patients with myelofibrosis have very heterogeneous presentations and a spectrum of different disease burdens and wishes of care. So patients can present at lower risk disease with little disease burden, and they have emphasis that is more towards disease modulation and disease alteration to having improved survival, while some other patients have more advanced presentations